Good afternoon, everybody. Good morning, good evening, wherever you are, whichever country you're hearing from me. I am Mrs. Omorodi Oroda. I'm a patient advocate and I'm the African Regional Coordinator for Confederation of Meningitis Organization, COMO. Thank you for taking the opportunity to come and listen to me. I'm here in commemoration of 2025 World Meningitis Day. I believe one way or the other you may have heard of World Meningitis Day. If you've not and this is your first time, thank you, and I'll appeal that you listen to the little discussion I'm going to hold about meningitis. This year, we are standing on the premise of a call to action because meningitis needs to be defeated. A call to action for each and every one of us to play our part so that meningitis will be defeated. Now, you ask me, what is meningitis? Meningitis is an inflammation of the menin. An inflammation in the menin. The menin is, is like a lining, a tiny lining that protects the brain and the spinal cord. Somehow, those in the medical term, they can easily put this into drawing, from the spinal cord backwards and to the brain, there is this tiny lining that protects it. Now, when there's an inflammation on that particular line, on that particular membrane, it leads to meningitis because it's a very terrible condition. Yeah, meningitis, like I said, is a serious condition that requires medical or immediate medical care. In fact, we say meningitis is an emergency health condition. Meningitis can be referred to as an inflammation of the protective layers surrounding the brain and the spinal cord, just like I said before, the menins. So please, you can look out for such words. Why is it so? You can look out for it. Like I said again, menin is a layer that protects the brain and the spinal cord from injury, and it provides support. It provides support to the brain or the structure of the brain and the spinal cord. But once that inflammation occurs, the person is already in trouble. It contains nerves, blood, vessels, and protective fluids. So you can see why it is dangerous when there is an inflammation there or when there's an issue around there. Now you will ask me, this meningitis I'm talking about, what causes it? What can lead to meningitis? Now there are two different ways. One we refer to as the infectious cause or the non-infectious cause. For the infectious cause, we are looking at things like bacteria, viruses, fungi, parasites, all those medical words. So those ones are the ones that are caused by infection. Then the non-infectious one could include diseases, certain medication. We can also look at something like an injury. For instance, somebody had an accident, an accident that would have led to something affecting the brain, or even a form of, for instance, you slap a person. Let me use a child, an adult. You give a child a slap, as the way we say it in Africa, you give a child a slap, and that heat, that pressure now affects the brain. Something like that could lead to meningitis. So meningitis is not something that any one of us should joke about. It's fast, it's ruthless, and it's deadly. It can strike anyone, anywhere, at any time, taking a healthy life within a period of just 24 hours. The person can, the person is gone. Meningitis is scary. It's scary. In fact, I used to tell people that meningitis is worse than HIV because for HIV, the person still has his or her own life to live after. But for meningitis, once it happens, the person is likely to lose his or her life within 24 hours. Now, if, for instance, somebody is lucky to survive meningitis, we call it after effect or aftermath or sequelae of meningitis. If the person is able to survive it, some of these after effects or aftermaths are also not too conducive. You understand? So I want to talk about some of them because it's good we know them. Now, if somebody survived meningitis, some of the side effects could be loss of limbs, loss of hearing, loss of sight, epileptic condition. The person could be bedridden. Now, picture someone like that. A person that was once a while very agile, very mobile, somebody that is very lively, all of a sudden become bedridden, or they have to cut off, something like that. So you can see that such a situation is not worth it. So we really need to take action because if somebody has brain damage or limb loss or epilepsy, of course the life of that person has automatically changed. And for us as women, you know, the burden of health challenge, we're not looking at the financial aspect, the emotional health challenge falls more on women. So I'm not here for gender issue, please, but so that is why we have to take more steps to see that, one, we know the signs and we know the symptoms, and we should be aware that if we see any of the signs or symptoms, we should take immediate action. So like I was saying, the lifelong impact of meningitis is not a child's play, so it's good that we know the signs and symptoms. Now, some of the signs and symptoms include a person that has meningitis. One, we find it so difficult to face the rays of light or sunlight, either sunlight or whatever that is light, the person finds it so difficult to face that light directly. Another one is stiff neck. Once there is issue of meningitis, you notice that the person will find it difficult to turn the neck either left or right or whatever direction. It becomes so impossible for such person. Another one is that there is this severe headache, that unexplainable headache that the person develops. Sometimes you see the person shouting, the person is just restless, especially shouting because of the headache. The person is complaining bitterly because of the severeness of that headache. So please, when you notice some of those signs, please do not waste any time. Take that person for medical checkup. Take the person straight to the hospital. It may be meningitis. Then another one, we talk about vomiting, we talk about high temperature, but for the stiff neck, the irritability to sunlight, and that headache issue, please, those are the very glaring symptoms that you may suspect that it is meningitis. So take the person to the hospital for immediate medical care. Meningitis is defeatable. Yes, this terrible disease, this health emergency condition is defeatable, and that is why I'm here today to let us know that we can defeat this meningitis, notwithstanding how threatening it is. Meningitis can be defeated, and that is why the World Health Organization estimated that defeating meningitis by 2030 is possible. Defeating meningitis is possible based on some certain condition, and in view of that, the World Health Organization some years ago came together and they developed a document called the Roadmap to Defeat Meningitis. They didn't develop this document alone. They brought stakeholders, medical professionals, civil society organizations, different group of experts they brought together to come and deliberate on this document, on the strategies on how meningitis can be defeated. And this document was developed, and we have what we refer to as the Roadmap to Defeat Meningitis by 2030. And they went downward to say, okay, now that this document has been developed, it is good that each region should also develop their own. And in view of that, the World Health Organization, the Afro region, they brought together ministries of health, different agencies, and they came together and were able to develop the Afro framework to defeat meningitis. I'm sorry about that. There's the regional framework to defeat meningitis that been developed by the Afro region, of which steps by step, the various pillars, the various strategies that can be followed to see that meningitis is defeated. And they too didn't end that way. They also brought countries together, different African countries together, and they put them through on how to develop a national plan. And as I'm talking to you, most of the African countries, they have their national plan to defeat meningitis. I'm in Nigeria, and in Nigeria, we have our own national plan to defeat meningitis. Now the next thing, which falls back to you and I, as an individual, as an agency, as a ministry, as a civil society organization, it is now our responsibility to hold our government accountable, to go back to them, to call on them that those strategies that have been laid down in that national plan, they should bring them to be. They should bring them up, and let's see how meningitis can be defeated. And you also, that is an individual hearing me, you have a role to play to see how meningitis can be defeated. Now we are marking the World Meningitis Day, today being the 5th of October, is our day to mark World Meningitis. I'm also sure that if you go online, you may see 24th April. Yes, World Meningitis Day was initially 24th April, but now it is 5th October, so that you don't get confused if you see it online. So as an individual, as we're marking World Meningitis Day, we all have roles to play. One, as I'm creating awareness, you too you can create awareness. You've heard from me. You can also create awareness. You can tell somebody, let that person tell the other person of the signs and symptoms of meningitis, how dangerous meningitis is, the various vaccines that are available. There are vaccines available for prevention of meningitis. Lest I forget to say it. In Nigeria, for example, in the primary healthcare centers, part of our routine immunization is the immunization of children from 9 months old with a vaccine called the Men A vaccine to help them prevent meningitis. And there are vaccines for adults to prevent meningitis. But the most important thing is that we should know the signs and symptoms, because when we know the signs and symptoms, we will know the next step to take. So I go back to the role we can play. I've talked about awareness creation, that you and I can create awareness. Then another role we can play, are you a survivor of meningitis? If you are, you can reach back to me. We want you to help us to share your story, tell your story, what you experienced about meningitis, or you are a caregiver, you had somebody that had meningitis. Please come and share to the world what you passed through, because I know if you're a caregiver, you have a very long story to narrate of your experience of that your person that survived or you lost through meningitis. Then the last one, which is also another way to spread, to commemorate World Meningitis Day, is to light the road, light the street. This light will help us to show solidarity to those who have lost their life to meningitis. So my dear friends, you all have a role to play. We all have a role to play to defeat meningitis, and that is why I'm calling on you. We need stronger commitment and action from different countries, global health organizations and donors. This is what we drive the race to defeat meningitis. So millions of people can have a brighter and healthier life when meningitis is defeated. I'm calling you all, meningitis can be defeated. Now is the time for action. This World Meningitis Day, we are speaking life-saving awareness of meningitis and its symptoms, calling for significant improvement to treatment and support, and demanding better access and availability of the vaccines that saves life. So to defeat meningitis once again, you and I should play our role. Meningitis can be defeated. This is a call to action that every one of us should take part, to play parts, to do whatever we can, to talk to our government. Remember I said that we have national plans as African countries to defeat meningitis. So join us as we defeat meningitis. It is a call to action. Thank you very much.